I'm Dr. Faria Ramos. I'm really excited that today we're taking this time just to, have more education, take control over our health, prevent many different conditions that you might hear about it, what to do, but maybe you don't have a strong, knowledge, or you have maybe mixed information. So that's why we're here today. And we're just gonna wait a little bit, right, Dawn, to
Mhm.
maybe get more attendance in the Zoom meeting because we had a good sign up list. So let's wait a little bit and then we'll see how that goes. Let's try.
Hormones are such a big hot topic these days, aren't they, Dr. Ramos?
Yep, it's a very hot topic and so many things that are linked to it. And again, the good thing is that a lot of people now they are really attending to these podcasts and different learning modalities that makes things easier in a way for us that we're functional doctors, because it's not the same when you don't have any knowledge about your body and how important it is. It makes it easier in compliance and really knowing what you can do on a daily basis and really get success to whatever treatment we put together, because it's not just me giving you all the different information. It's we're working together in really getting to resolve, reverse and prevent conditions. That's the whole importance. And obviously hormones play such a huge role. And now there's more and more information. Yeah,
Yeah, and there's been a lot of controversy about hormones too, hasn't there?
a lot. And we're gonna go over those as well. So it's gonna be very exciting this next, half an hour, 45 minutes that we're gonna have to get, over all of those questions that you guys might have and everything that again you might hear, but you don't know if it's true or not, some myth, which it's normal. It happens.
So,
Okay. So can you tell us about osteostrong meanwhile?
yeah, I would love to. So OsteoStrong is a musculoskeletal strengthening center, and we're in 17th Street in Fort Lauderdale. And we have proprietary equipment that enables you to put high levels of force through your skeletal system in a safe way. And that's what triggers bone growth. So a lot of people have been under the impression that just regular weight bearing, if they lift weights, they're going to get a big movement in bone density. They may prevent some loss, they may have slight improvement, but if you really, really want to make a big, send a big signal to your body that you need stronger bones, you have to put a lot more force. And that's what our equipment does in a safe way.
And it's actually really cool because when I went to visit you, like, I had a trial and it's like you are against your own body. So it's like how much really you can compete to yourself. And then you feel like the next days, like you don't feel it right away, but a few days later, you're like, you're sore. Like, and it's not like heavy, it seems like, because again, it's like you on your own body, you can see the strength that you're building along, the exercises when it gets higher and higher intensity. But it's that resistance, with the machine. It's very interesting. And then I like also when you show me like the height, how our posture all the time, like we are, bending or having bad posture, how it changes also, right? So
Mhm.
because bad position, because there is the strength of the muscles, because the spine is not aligned properly. So all these different challenges that we have all the time. And when we exercise and we are more targeting the musculoskeletal in a different way, like going to a gym, which is great. Pilates is great, like all these different modalities. But when this is more concentrated in your bone and your musculoskeletal, you notice the changes, like as I was mentioning, the height. So I really like that part when you show me, that how we can change in the measurements.
Mhm. And what I think a lot of people don't realize is that the strength of the bones is what determines how strong you stay as you age. So
Mm-hmm.
as your bones start weakening when you turn 35 or about 35 and they're getting weaker, the body says, wait, it's not safe for the muscles to stay strong if the bones are getting weaker. So if
Mhm.
you want it all to get strong, you need to strengthen the bones as well as the muscles.
That's right.
Yeah.
All right, so I'm going to share the screen.
Okay. I'm gonna just we'll get started and I'm gonna introduce each of
Yeah,
us.
yes.
Here we go.
Let me know. Okay, there you go.
Great. So I want to say thank you for everybody that's joining. My name's Dawn, and I'm the owner of Osteo Strong on 17th Street. And today we're going to be talking about hormones and overall health. And I just want to share a little bit about me. I was originally diagnosed with osteoporosis in the bones of a 90-year-old about 4 years ago, and it was a big shock. And I was looking around for different remedies and didn't find a good fit. I wasn't interested in taking the medication. I wanted a more lifestyle-based approach. Became an OsteoStrong member and noticed improvements in my bone density. And since I've been doing OsteoStrong sessions and have since opened my own OsteoStrong, I've improved my bone density tremendously, and I get to watch my other members improve their bone density too. So it's really just an amazing journey. I want to introduce Dr. Ramos, and she is a double board certified doctor, MD, and she's certified in both functional and internal medicine. And she's bringing an integrative, high quality care to the South Florida community. She's in Fort Lauderdale. And her approach to medicine is rooted in a deep understanding that healthcare is an art and a science, requiring a comprehensive training and appreciation for the unique needs of each patient. Everybody has their own issues that they're faced with. So she chose to specialize in internal functional medicine because of the holistic complementary focus. And both of those fields prioritize lifestyle as a central component of health and offer a broader range of diagnostic and therapeutic options than conventional Western medicine alone. And this allows Dr. Ramos to address the root cause of health issues while promoting true healing and wellness. So take it away, Dr. Ramos.
Yes. Thank you. Thank you, Dawn. Thank you. So, well, I don't have to present anymore because now you guys know a little bit about me. But honestly, what I would like you to guys, take advantage today is there's going to be a little bit of, different hormone information or hormonal information, I would say. But again, as I was mentioning initially, it's education is so important. It's really the one differentiator that we will have from any other person that doesn't have maybe the time, maybe doesn't have the motivation to know about your own body. So I want to thank you in advance because you're really taking this time to know about you, to really start restoring, regenerating, repairing. And I'm a true believer that we have all the real, ingredients in our body, in our soul, in our mind to heal ourselves. It's just that we need to put this connection, we need to put it all together and get to that recipe. So here I am. I'm going to give you everything which, and all my love. And I hope you get the greatest information from this. And we're going to have questions at the end. And, along the way, if you have any, just if you can write it down and we can go over those. Good?
And just a little reminder too, if you're listening on the Instagram, if you want to participate in the questions, go to the link and sign up for the webinar.
Thank you. Okay, so we're going to talk about hormonal harmony, the connection between brain, breast, prostate, bone health, and the balance between all of those. So we start first as, exactly what is a hormone, right? So a lot of people, they hear about this, this term hormone, but it's very simple. It's just a substance we produce in many different areas in our body by different organs. And the key is that it helps for the overall health. It helps for balancing everything, your metabolism, your energy, and ultimately your healthy longevity. The function is to regulate, is to control the activity of certain cells. So cells are the ones that are inside each of the different organs that we have. And this is key because if we don't have good cells, those are where we naturally produce our energy, then nothing will work, right? So that's where we call the hormonal web. And the hormonal web, it's just the interaction that it happens in between all these hormones. They're always going to be connecting. They're always going to be, talking to each other. So having a symphony, it is key to balance and maintain your health. And that's where we have, all these different interactions in different areas in our body. We have the reproductive hormones, which are the sex hormones, also known as sex hormones, estrogen, testosterone, progesterone. A lot of people, they know about them, and they have certain associations between each of them, and we're going to go over those. We have the adrenal hormones, which are the ones produced on top of the kidneys, and they are responsible for cortisol, which is also known as the stress hormone. They have DHEA, they have pregnenolone. So these, I'm just throwing fancy names, but just for you guys to know that there is more than just estrogen, testosterone, and progesterone. Pancreas is another organ that it produces key hormone, which is insulin. A lot of people, they are just thinking about the pancreas, for many different reasons. And it's so important for the sugar. It's so important responding to cortisol. It's so important also to digest, of course. So it has many other functions, but this is one that we know. A lot of us knows about the sugar regulator. Thyroid, key, super important. A lot of people, they just say, okay, thyroid and weight. Oh, I'm gaining weight, most likely it's because my thyroid, but it has many other functions, and we'll go over those. Parathyroid, the one that are on top of the thyroid, a lot of people, they don't know about this gland, and they are just sitting on top and below the thyroid. Important to regulate calcium, important for bones. Go over that. So they all interact, and there are more. I'm just giving you some of them because if not, we're gonna, sit here for 2 hours. And this is actually my specialties in functional endocrinology, but they all need to be interconnecting in an optimal way because they will influence each other in good ways or bad ways. So we're gonna see what's that specifically. So again, balance, in tune or out of tune. So when they are in tune, you're gonna feel healthy, vibrant, you're gonna have better energy, resilience, your immune is gonna be the greatest, and that's overall the healthy longevity that we're looking for. If they're out of tune, then you're going to have symptoms such as fatigue, mood swings. You're going to have your weights, not controlled, either too high or too low. And obviously chances to develop chronic conditions like high blood pressure, high cholesterol, heart attacks. In summary, not optimal aging process. So do you want to be in tune or out of tune? That's the key, right? Obviously, everybody would like to be in tune. So the hormones, what happens throughout our life, they're always going to be changing. It's completely normal, right? So the factors that can affect not only the aging process are stress, certain nutrient deficiencies, diet, toxins, pregnancy, exercise, aging, as I mentioned before, microbiome, which is all the good bacteria that they live, or other microorganisms, other bacteria, yeast, viruses that they live in our GI, in our colon, and medications, just to name a few, right? Now, let's talk a little more now in terms of thyroid. So thyroid is only for weight control, or is there something else that is related to thyroid? So regulates your metabolism, and it's going to affect multiple bodily functions. If it's too high or too low, it can cause problems with weight, energy, bone. So having the high thyroid, which is hyperthyroid, is linked with osteoporosis. So we don't want that turnover to be so fast. Skin and gastrointestinal, as well as heart problems. Gastrointestinal is your gut. It can make you more constipated. It can give you diarrhea. So depending if it's too high or too low. The diagnosis, a lot of people, they go, to their conventional primary doctors, and they just have a partial thyroid panel. When we are looking into bone, when we're looking into aging process, if we're looking into healthy aging in general, we need to have a complete thyroid markers. And that's why I'm putting in caps, because it's not just TSH, T3, T4. We need to look at the precursors. So that's where in functional medicine, we look the whole, markers, and we determine, are you maybe getting into a subclinical, low function or high functioning? So we want to catch whatever it is at an early stage. So we do 7+ markers to determine if there is something happening or it's already full-blown low or high thyroid. Treatment. Treatment is nutrients, whole foods, nutrient as supplements, your gut optimization, which again, your microbiome, toxin elimination, low dose naltrexone, which this is a more functional compounded medication that we use to reverse autoimmune conditions such as osteoporosis, such as rheumatoid arthritis, such as Hashimoto. So this is one compounded that I use it a lot in my practice, obviously depending on what exactly is the condition. But in osteoporosis and Hashimoto's and Graves, which are autoimmune conditions, I use low dose naltrexone, thyroid gland extract, and thyroid replacement. So it's not just, oh, I just got diagnosed with hypothyroid or hyperthyroid, just go and get the medication. It's more than that. So you see all the different treatment options that we have, and we want to go into each of different ones to really get to heal the thyroid. Because the fact that you have taken thyroid medication doesn't mean that's the only modality for treating your thyroid, right? So that's thyroid overview. Let's talk about estrogen. So reproductive, one of the reproductive hormones, and it's considered another growth stimulating hormone because that is stimulatory. Estrogen helps to grow, right? So it is produced by both males and females. So it's not just females. Males also produce it, and they produce it in the adrenal glands. And we start producing it in the adrenals when the ovaries are not working anymore, which it happens in menopause. There are 3 different types of estrogen. We have estrone, which is the strongest estrogen that we have, but is the highest inflammatory. Estradiol protective, estriol protective. So these 2 are the most protective. This is the weakest that we have, but it's important for breast protection. And this is the one that we want to replace for bone protection. We never replace estrone. What happens, how do we get estrone? Sometimes our body, because of many different pathways and things that happen internally, it can become this estradiol, the good one, it can become estrone. So that's where, again, everything that we are doing in functional medicine, it helps to really maintain this good estrogen as a good estrogen and doesn't become into bad estrogen. Externally, we have xenoestrogens, which are other type of estrogens that they are a high influence to develop more estrogens. So there are different sources why people get high estrogen, and that is measurable. We do tests to determine if you have high estrone, which is deteriorating your bones. So we want to look into estrone, estradiol, and estrone. We do have receptors of all of these type of estrogens. Receptors are proteins that they are uptaking the actual hormone. So we have it in many different organs, in the brain, in the muscles, in the bones, in the bladder, in the heart, everywhere. We have more than 400 vital functions that are related to estrogen, including mood regulation. So when you guys feel, okay, I'm having mood swings, my period is about to come, or I'm getting, into menopause or andropause, and now I'm not the same, I'm very edgy, estrogen. Skin health, brain support for dementia, very important. Metabolic rate, which is, again, metabolic rate is about weight. Gaining too much weight, especially in the midsection, is estrogen. Blood pressure optimization, bone density, to name just a few. Deficiency. So here we're going to have different symptoms related to deficiency of estrogen. Acne, wrinkles, thin, oily skin, hair loss, arthritis, joint pain, brain, as I was mentioning before, your metabolism, fertility, mental health, which I see it a lot, anxiety, depression, PMS, osteopenia, and osteoporosis due to estrogen deficiency. Obviously, as we age, that's one of the causes. Smoking, insulin resistance, so that's where pancreas, again, we're connecting, right? The pancreas, when we have a problem with too much of insulin and the muscle is not getting that insulin, that's going to send a bad signal to the estrogen. It's going to start depleting and depleting. Low thyroid, another connection. And medications. Just to name a few, trazodone, sucralfate, which are some medications, but there are many others. Deficiency, what are we going to do about it? Number one, we have to look for the root cause, right? So is it in your diet? Is there something that is making this estrogen to be deficient? Is it an absorption issue? Is it your adrenal glands, your thyroid, and your gut imbalance or aging process? So all of these we need to connect. And the treatments, so there are different modalities, and that's where a lot of people, they are just concerned, should I really start replacing my estrogen? I passed already menopause and it's in my 60s or 70s, whatever age, right? So the idea is to always, and I'm going to go into that as well, but the idea is to determine the sooner, obviously, the better. determine where you are at the moment. Are you estrogen deficient? Are you estrogen just suboptimal? Depending on that, the modalities of treatments are going to happen. It's going to be a cream, it's going to be a patch, it's going to be a pellet, or you only need nutritional exercise support for males and for females. Sometimes we don't need to get to the actual replacement. We just need to get better nutrients. We need to get better absorption of those nutrients to really boost your estrogen. So it all depends. Is it completely insufficient or is borderline? And we're going to get into bioidentical hormones in a few minutes. Now, if it's in excess, that can give you also symptoms. So you have to watch for this: bloating, fatigue, heavy periods, or irregular periods. That, let's say you stop having menstruation, and then after 2 years and you start bleeding. That's estrogen excess. Mood swings also increase cancer risks, and this is very important. Your own estrogens, and that's where when we were talking about the estrone, that's the one that is being linked with uterine, prostate, breast enlargement in males and females, and prostate enlargement, high blood pressure, heart attack, strokes. So excess also due to nutritional deficiencies, zinc specifically, or if you're taking excess of vitamin E. So you have to be careful with nutrients because not all of them, because I'm taking it, it's antioxidant. Yeah, but if you're doing excess, that's not good either. So always you want to measure, always you want to have someone that is overlooking and telling you this is the right dose for you. Medications, of course, excess of alcohol, diet, and poor gut health. And the support, we're going to do zinc, obviously, if it's a deficiency, we repair. Maca, some botanicals, vitamin B3, chrysin, grapeseed extra. So these are just natural approach. And obviously in food, alcohol intake, we want to lower those and other nutrients and lose weight. All right, now let's look at the progesterone. So progesterone and estrogen, they always go together. Even if there is no uterus, we always want to have progesterone balance. Progesterone is the brake and estrogen is the accelerator, okay? So let's go into progesterone. And here I see the relaxing hormone because it's true. The progesterone is more easy and digest. The estrogen is more fight and flight mode, right? So what is the progesterone? It's one of our sex hormones, also produced by males and obviously females, right? Ovaries and adrenals, so similar to estrogen. It plays a role in menstruation, in pregnancy, and embryo formation for females, obviously. And these are some of the key functions. So we have balancing estrogen levels, promotes a solid deep sleep. And this is very important because a lot of patients, when they start aging, which when I say start aging, doesn't mean your chronological age. You can start aging in the mid-20s. Huh? And I have patients that they start having symptoms of aging at that chronological age. It's not your cellular age, right? So that's why we need to test. Promote solid deep sleep. And that's one of the symptoms that I'm not having a good sleep. I wake up, I'm tired. That's one. Then in your bones, again, it's going to help the bone. It's going to prevent anxiety, mood swings, your bladder, your gut relaxation, immune support, prostate and breast. Okay, so obviously many different symptoms that are related to, and then you can see it again, one more time, osteoporosis, weight gain in the middle section, constipation and bloating. Deficiency, we have antidepressants, thyroid hormone, cause of deficiency when you have low thyroid, and again, connecting, right? Vitamin deficiencies such as A, B6, C, and zinc, or increased prolactin, which is another hormone. Saturated fat, so not obviously a good balanced, healthy fat intake. It's going to be detrimental for your progesterone. Too much stress, excess of sugars, refined sugars, obviously, and again, stress here. And the treatment, we want to have natural progesterone, which is a bioidentical, and that can be given as a cream or by mouth as a capsule at night. Typically, that's for females. Males, we only treat severely deficient. And I have treated patients when the progesterone is too low, we use it as a cream. And excess of progesterone can only be addressed by reducing external sources of progesterone or pregnenolone, which is another form. Okay, now, this one is about excess. So very similar. It can suppress your immune system. It can increase fat storage, increase cortisol, sexual dysfunction. So actually, progesterone can behave very similarly when it's in excess or when it's in deficiency. So the idea is to see exactly where you are, and depending on the results, we will get to the treatment option. Testosterone. Is testosterone only for males? No. Testosterone is also produced by females, as I said here, right? And it's produced in the adrenal glands and the ovaries in women. The production decreases with ages in both sexes, and only 1% of testosterone is free. So this is important because testosterone, when we measure testosterone, there are some physicians that they only measure the total. The most important part is the free, which is the active portion. And that is the one that is being utilized in your cells. And that's the one that is going to create all the different benefits, which obviously benefits are, bone is going to help for the body fat. So if we have any problems there, then you're going to have more bone deterioration. You're going to have excessive body fat. You're going to have these natural antidepressants that are going to be affected. Your memory is going to be affected as well. So these are all the different functions that we have, as well as sexual interest, which is what is being linked in the society. Everybody thinks testosterone is sexual life. No, it's more than that. It's your brain, it's your bone, it's your muscle mass, it's your metabolism. So these are all the different functions that we can see. And these are obviously efficiencies related to everything here in the mental health, anxiety, also declining the muscle tone, decreasing the good cholesterol, which is the HDL, risk for Alzheimer's. It goes higher, and I see it all the time. Patients that they have problems with low testosterone, they have higher chances of memory loss, and dementia, Alzheimer is one of the types. So we want to really get without free testosterone. Causes aging, chronic stress and exposure to toxins, trauma, especially in the brain, infections, poor diet, alcohol, drug use, and other hormones such as prolactin, diabetes, again, the insulin or insufficient protein intake. Some of the causes of testosterone deficiency. And the treatment, again, we want to get to the root. Is it the calorie intake, or maybe exercise is not regularly done? So we want to get to lifestyle, the same dietary protein, certain supplements, arginine, leucine, glutamine, zinc, it helps. But again, these are measurable. We want to see where your levels are before you jump into replacing these supplements, because they also have certain side effects if you have too much. Adequate sleep, as anything, because that's going to be helping with a cortisol, melatonin, and that's going to get a good signal to testosterone production. Lose weight if you have excess, of course, and manage stress. And testosterone replacement if you need it. If you're really low that you need the replacement, the options are creams, pellets, or injectable for both men and women. Oral testosterone, this is important because a lot of people, they have asked me this question, oh, can I just take testosterone by mouth? Not recommended. It goes into the liver, and it's been linked with liver malignancies, liver cancer. So the natural testosterone is the preferred, and obviously that's the one that I was just mentioning, as a cream, as a pellet, or as an injectable. And this is the same testosterone linked to liver cancer. So we don't want to do anything by mouth that is oral testosterone. Excess can be similar to the excess of estrogen as well, right? So these are more stimulatory. So we really want to see, there is a lot of overlapping in between symptoms with all these reproductive hormones. The key really is to get a good test, a saliva test, a blood test, to see where you are. Are you in excess? Are you deficient in any of these three reproductive hormones? And here's some connection, right? So some research has shown testosterone requires optimized estrogen for effectiveness. Without enough estrogen, testosterone cannot bind to brain receptors properly. And estrogen is essential for testosterone to work effectively. So you see, now there is also progesterone and testosterone that are linked together. So they're all, as I was telling in the initial of initiating the presentation, they're always in symphony. They're always talking to each other. Now, this is two hormones, DHEA and pregnenolone. These are the missed hormones, because a lot of people, they don't know about it. They don't even, like test it. They come from the adrenals, the ones that are on top of the kidneys. And this DHEA is a small amount, is also produced in the brain and the skin, and declines again as we age, which is normally in the late 20s. And this is key because it's going to produce estrogen and testosterone. So it's not only ovaries and the testicles, we also have a reserve from the adrenal glands. And these are different functions that we have: allergic reaction, cholesterol and fatty deposits. It's going to help with the stress, tissue repair, bone growth, brain function, lean body mass, well-being. Your metabolism is going to help triglycerides. It's going to promote weight loss. It's going to reduce insulin resistance. It's going to help your sugar, and it's going to support the immune system. I check all the time the DHEA in blood, because deficiencies are all of, obviously, opposite of what we just say. It's going to decrease your energy, your muscle strength, difficulty dealing with the stress, increased risk for infections and irritability, joint soreness, and weight gain. The causes, again, similar to the others: aging, decreased production, menopause and andropause, smoking, and chronic stress. And the treatment is going to be replacing DHEA as a cream or compounded, which here I will add the same. If there are some nutritional imbalances, we can always help DHEA to get better. So zinc, selenium, but also measurable. And then if it's really low that we need to replace it, those are the ways that we can do as a cream or a compounded medication. In excess, it's going to do acne because it's going to produce too much testosterone, anger, a deeper voice, depression, facial hair, fatigue, insomnia. And the causes can be stress, excessive DHEA supplementation, and tumors in the adrenal glands. So this is when it's really high. Then I always look into adrenals. We can do an ultrasound or we can do a CT scan and make sure that it's not related to a tumor. Pregnenolone is the other one coming from the adrenal glands. This is the mother of all the sex hormones. This is even before estrogen, testosterone, and progesterone. We have pregnenolone. It is mainly produced and only produced in the adrenals. It's going to make all the hormones, including cortisol. By the age of 75, the production is only 65%. It drops 65% than in your 20s or 30s. So it's really, really low. This is the one that I see, again, for patients with dementia because it helps to enhance the nerve transmission and memory. So for patients that they have memory issues, this is one of the key hormones. It's going to repair nerve damage, improve energy. Mood elevation is going to promote, reduces pain and inflammation, and it's going to balance nervous system. So it's all about your brain. This, if you want to take one point, pregnenolone and brain are just very tight. Symptoms, very similar again: arthritis, depression, fatigue, insomnia, lack of concentration, memory decline. Aging process obviously has causes for low pregnenolone, low cholesterol. And this is key because a lot of people, when they are taking medications to lower cholesterol, if they go too low, that's not good. Below 120 of the total cholesterol is very bad. You are not going to naturally produce your hormones. So always watch for that. We always want a balance. We want to have a good cholesterol and we want to have a good production of your hormones. Okay? Even if patient had a heart attack or a stroke, going too low is not healthy. Low thyroid and pituitary tumors, stress, and the treatment, we can replace it if it's really low as cream or tablet. And obviously, you also want to look for the root causes: nutritional deficiency, toxins, and other hormonal imbalances. And excess, very similar as well. So some acne, drowsiness, fluid retention, headaches, heart racing, insomnia, irritability, because it's also an stimulatory. Pregnenolone gets into DHEA. DHEA gives estrogen, testosterone. They are all stimulatory. The only one that is more calming, relaxing, resting is progesterone. Everything else is going to stimulate. So that's where you see that they are overlapping in symptoms. And the treatment, we want to lower any external sources of pregnenolone if you're taking. We're going to lower stressors in the gut, nutrient, or cortisol imbalance. Okay, now let's connect the dots between the bioidentical hormones and what is the impact that it makes in the breast, prostate cancer, for instance, dementia, heart health, and bone support. So it's the fun part because I gave you a lot of now physiology and education. So the impact of the bioidentical hormones on chronic diseases is influenced by age, duration, dose, type, and route. The outcomes are going to vary depending on each individual factor in a specific regimens. And let's go closer and see. So for instance, in cognitive health, so for your brain, one of the newest studies, and when I say systematic review, is many different clinical studies that they put together, and they examine what is all of these about bioidentical hormone and the effects on dementia risk. They show that there was an 11 to 33% reduction in dementia risk for both men and women without prior dementia. So this is very important because it's giving me tons of clinical studies in which they have seen a good hormonal balance, bioidentical, how it's huge, 11 to 33% of people, how they improve their cognitive. So it has some protective cognitive effect for certain individuals. Why? Because obviously, if you had other risk factors, if there was diabetes, if there was high blood pressure, it's not the same unless we're treating everything, right? Because some people, they just get into dementia, but they don't really get to the bottom of why you develop dementia. Dementia is not just Alzheimer. If there is diabetes, if there is high blood pressure, if there were strokes in the past, if you have heavy metals, if you had, mold, like many different factors that they contribute to dementia, we need to get to the bottom. That's why it says for certain individuals, all right? Now, what about the heart and the blood vessels? 2020, in 2020 analysis, they reviewed the relationship between the bioidentical and cardiovascular outcomes. 26 trials, 47 were observational, and they found that there was an increased risk of blood clots, but decreased risk of heart attack. So when this happens, blood clots in excess, even if it's bioidentical hormone, and that's why if any of you guys are going to go into bioidentical hormones, you always need to monitor. Excess of is always a risk for. So even if they are natural, if you do excess of estrogen, bioidentical, there is a risk. If you do synthetic, it's going to be 10 times more. So it's even higher, right? So we have to be careful with dosages. Now, what about your metabolism? The bioidentical hormones has been associated with improved metabolic markers and insulin resistant and fasting insulin in sugar, cholesterol, and also blood pressure. Now, optimal outcomes. Personalizing BHRT is the key. You need to personalize. You cannot have it just everybody having the same dose of progesterone, estrogen, testosterone, or DHEA. We need to get the treatment based on the unique health history and needs that they have. So that is going to mark the difference. So what is the overview of bioidentical in menopause and andropause? Bioidentical hormones, they both have good and bad. That's normal. It provides definitely symptom relief and health benefits for certain populations. Risks and benefits should be carefully weighed based on each individual case. So what are the recommendations nowadays? So research has supported that hormone replacement can be done and beneficial for women and men under 60 or more than 10 years post-menopause. And this is important because a lot of patients, they say, okay, I'm in my 40s or in my 30s. Do I need hormone replacement? Yes. Or I passed already 5 years, 10 years, 20 years of menopause. Do I still need it? Yes. Your good hormones are the ones that are going to protect us against anything that is chronic and deteriorating, our health. And not because we age necessarily, we're going to have low hormone. It's the opposite. As our hormones start lowering, we start aging. You see? So the benefits always we want to outweigh the risk in younger population that they have no problems. And this is something that the clinician, the physician that has a formation in hormones can tell you, okay, you know what, it's a good idea that you go into testosterone or not, or let's do more nutrient support. Timing and duration are key. Hormone replacement versus the bioidentical hormones, we want to see the difference, and we're going to go over those. And it's prioritized for women with early or premature menopause, of course, and they face because they have higher risk for chronic conditions. Okay. Now, bioidentical, it's pretty much giving back what is missing to achieve the balance in the face of stress, menopause, or other hormonal imbalance, and andropause as well. So what is bioidentical? It's chemically, the structure is chemically the same as the one that we produce. So this is identical in the substance, yes. The dose is what you need. So that's something that we have to test in blood and saliva. Is the duration enough, or is it for too long, or is it too short of a period? So this is what is going to make it the most personalized approach and identical to what we naturally produce. And obviously pharmaceuticals, that's not going to be, the criteria, they won't meet that because they come in just 1 or 2 dosages. The duration, some people, they use it for the rest of their life, which is not good either. We have to have certain criteria when to have a holiday in your hormones. So we always want to mimic what we naturally produce. And the substance is synthetic. So bioidenticals are plant-based, and the other hormones are synthetic. They come from different sources, such as, horses. So the urine of the horses, they take that and they use Premarin, they use like different synthetic, which are obviously way higher than what we naturally produce. which is here. Synthetic hormones come from horse urine. That's one example. And the majority of them, they come from different sources that are not equivalent at all to what we naturally produce. So that's where synthetic and bioidentical makes a huge difference, because it's not going to make any sense to your body having 10, 20, 30 times more effect-wise, that it's going to be more detrimental to beneficial. So the impact of hormone and the type on the treatment. So the type of hormone using bioidentical is going to impact the efficacy and safety profiles. And these are the different ones. Example, the estradiol, which is the protective one, micronized progesterone are the ones that are more favorable. And obviously, the higher risks are with the synthetic hormones. Higher risk for cancers, for blood clots, as I was telling you before, high blood pressure, strokes. Those are the ones that are related to. And one more time, bioidentical, the benefits depending on all these different things. And the careful adjustment is going to increase safety and therapy outcomes. Now, for bones, this is the bone hormones, a complex web, because yes, bone is so important. As we start, in the mid-20s, our hormones starts changing. And the hormones, the bone requires a balance in minerals and hormone regulation. So it's not just, okay, I'm going to take vitamin D and calcium and that's enough. No, it takes more than that. It takes your hormones to play the role that they need to have in order to have an impact in a good quality bone. So to resume, I put these different hormones. This is the complex web. We have parathyroid, we have calcitriol, we have calcitonin, thyroid, and sex hormone. So we already talked about thyroid, sex hormone, parathyroid. This is the one that is going to regulate the calcium in the blood. It's going to help to stimulate the bone resorption and formation, okay? And it's going to help essentially to have a better mineralization in your bones and the bloodstream. Calcitriol is the vitamin D, so produced from the vitamin D, and is required for calcium to get absorbed in the gut and get transferred to the bones. That's where it should be. And it's going to work alongside with the parathyroid, which this one. So they're all working together. Calcitonin, this is also secreted by the thyroid. So this is, remember I was telling you, it's not just your metabolism and the weight, it's also bones. So it's going to help to prevent excessive calcium in the blood. It's going to protect the bone structure by reducing the resorption when calcium is too high. So these three are working all the time together. Obviously, thyroid and sex hormones as well. So this is our web for bone support. And we have other ones which are less common, like people know about it, but as important as the others, growth hormones and insulin growth hormone. They stimulate bone formation. And some people, they use growth hormone. And this is especially important during childhood and adolescence. It's important for maintaining the bone health across lifespan. We measure the growth hormone, and this is a way that we measure. Do we replace growth hormone? Yes, but not directly as a growth hormone. We replace it as analog, which are the peptides. And maybe some people have heard about peptides. So that's another modality of treatment for bone deterioration, which is osteoporosis or osteopenia. Cortisol, high levels can impair the bone growth and the strength. And steroids taken by mouth, right? Some people, when they get sick, they have asthma, pneumonia, they take a steroid. If you take it for a long period of time, or they have arthritis or things in that nature, that can induce osteoporosis. And that's actually the major cause of secondary osteoporosis, is the glucocorticoids. Insulin coming from the pancreas is going to support the bone growth and mineralization. It's going to regulate the formation and resorption, and it's going to impact, bone health in diabetes and insulin resistance, of course. And leptin, which is another hormone that we use it a lot in weight for patients that they're trying to lose weight, is going to influence the bone metabolism through complex mechanisms. So this is a little higher level. So, but for you guys to know that leptin, which is also important for weight, it is important in bone support. So we have many different hormones. It's not just, the sex hormones. There are so many that are implicated in a good bone formation. And here, so dietary, also it's, as I was mentioning before, anti-inflammatory Mediterranean diet. It's important. Nutrient-dense food are going to provide the essential vitamins and minerals. And the studies have shown that all the benefits on bone density and overall well-being comes from all these different nutrients. Now, do you really okay, you're eating perfectly right, balanced. are you really absorbing everything? So we need to test that. Instead of just guessing, I always like my patients to have a gastrointestinal or a gut test, which is a stool test, to check if you're really absorbing, if you're really getting, your microbiome well balanced, that is not being affected by other microorganisms. Is that your pancreas functioning well? Everything like that is going to be tested in the stool test, and also if you have leaky gut. So we can check all of that to help a better diet to get absorbed and to get cellular and ultimately to your bones. Calcium, vitamin D, certain nutrients that are crucial, vitamin K, isoflavones, omega-3, strontium, manganese, magnesium, boron, so and more. I just mentioned a few, but instead of guessing, let's do the nutrient test, which is a blood test. So all of these now with the technology and the advances in medicine, we don't need to just be taking things just as placebo or because I hear from, a friend or a family that they're taking it for bone support. We can really get to the bottom and personalize what your body needs in order to prevent and or reverse any bone deterioration. Exercise and mind support. So as Dawn was telling, initially the weight-bearing resistance exercises such as osteostrong, important because it's a connection in different aspects that is really going to help us to get to the bottom, which is restoring your bone. So nutrients, your hormones, your exercise, your mind and body interventions, so stress reduction, mindfulness, and all of that are going to be key for getting better. So what we did, Dawn and I, is integrating her part and my part. We put together a 12 months program, which is going to help testing, it's going to help diet, exercise, stress reduction, targeted nutrients, and we want to make it easier for you. So this is I just put it really quick here, and you're going to get, a copy of this presentation. So I just want, for people to know that there are so many tests out there, and, the modality nowadays, conventionally speaking, is to do a bone density DEXA scan and give you some medications like bisphosphonates or Prolia or whatever it is medication-wise. But really to get to the bottom and to avoid getting into that modality, which I'm not opposed, some patients, they need it. But instead of just getting to the end, why don't we get to the beginning of? Why don't we get to see what's going on with your nutrients, what's going on with the microbiome? Everything that I have told you today, this is a summary of. Pretty much we put it together. And Dawn also has her part, obviously. She has her services. There is some sign-up fee that she has waived for patients that they want to really integrate the medical part with the physical musculoskeletal part. And these are all the different services that you will get at a much better price. And obviously, having all of that and a special offer for today attendance, we put together a special offer for the next 7 days. So when you text either my office or Dawn's, then you're going to get what is special. But in conclusion, what we want to really get is to have a good hormone balance. We want to keep them in harmony. We want to regulate and monitor and have a better lifestyle adjustment. And we want to have someone that really is highly experienced and can help to guide you through anything that you guys do in the hormones, in the nutrients, in the GI, to get to the root problem and to personalize your treatment. Okay, guys, any questions? Please, if you can, we can open the mics if someone wants to, or we can do it through the chat, whichever is better. Let me see. Okay, Annette. You guys want to in the chat? I can see also the questions if there is any questions. I know it's a lot. I mean, it's a very dense topic. We try to cover in, I don't know how many minutes, maybe like 45 minutes. But the idea is to really, just ring the bell of, okay, there is more than just hormones. There is more than just nutrients. It's a connection that we always need to really get to the bottom. And that's, why I study this medicine, because we're really connecting the dots. In conventional medicine, we're just trained to prescribe. And there is nothing wrong with that, because again, sometimes we need it, but we never get to why. Why did you end up having osteoporosis? Why did you end up having breast cancer? Why high blood pressure? So that is what it really helped me or motivate me to study and to complete the fellowship in functional medicine, to get to the root cause. Why are we really having so many diseases? Like, we are privileged living in this country, but at the same time, it's been so manipulated and contaminated that we need to help our bodies. Like we have different sources, in the nutrients, in the water supply, in sources of, toxins. I'm talking specifically, that people, they maybe don't realize. So we need to be careful with things like that. And there are ways that we can test, and there are ways that we can detox our body. So be careful, but at the same time, enjoy your life. Because if you're going to be stressing for everything, that makes no sense. The idea is that there is a solution to anything that we can find. And if you put your part, we're going to be a team, or we're a team together, and we work. And I see results. Some patients, they achieve in 6 months, improvement in their bone density. Others, it takes a year. So it varies. But I really don't like to put a time. I always say just one day at a time. Just do your best, because that really is going to help the connection in the hormones. The more stressed you are, the more imbalances you will create to yourself, because your mind is always connecting to your body. And, if you're not sleeping well, like things in that nature, they're going to regress instead of going forward, right?
Well, and Dr. Ramos, when I was listening, I was shocked at all these, like some of these hormones I hadn't even heard of, pregnenolone, which, right? And it's like,
Yeah.
oh my gosh, and you could be too high, you could be too low.
Correct.
How do you know? And I think what's amazing about your practice is that it's testing. You figure out what the real story is and how to optimize.
Yeah. And again, it's not easy to go through, so many different things, in terms of testing, but at the end, at the beginning, it's always a little more challenge. But people, then they get it. They're like, okay, you know what? It makes sense. It's something that I would like to get more in detail, because I'm tired of, like not seeing any improvement and deteriorating my bones and having higher chances for whatever it is, right? Like negatively impacting your longevity.
Mhm.
So the key is, your knowledge. The key is you really putting into practice what you know, which is the hardest part.
Mhm.
One thing is knowing, another thing is practicing. But again, if you really want to do it, there are ways. Advances are there, technology is there, clinical trials are there about bioidentical hormones. So it's not like in the past that we only have synthetic hormones. In different other countries in Europe, they have, bioidentical hormones as preventative medicine. Hopefully, at some point we get there. Uh, but in terms, of really preventing medicine, we have now the advantages of functional medicine. And I'm happy that you guys are taking this presentation, and you can go over again. And if there is any questions, here our contact, for my office and Dawn, and we can help you, with anything that is in regards bone. We can put it together. Or if you want to try only, the exercises as well. So you can feel free to whatever modality you will consider is needed at this moment. Please do. We are here to help you. And again, this is just the beginning of education. We would like to do more. So at some point, maybe Dawn will get a survey and see what will be our next topic. Because education is gold. I always say that.
Okay, we're going to end. Have a great afternoon. Thank you.
Thank you, guys.